Right, let's get going. We're going to shift on now to probably talk about things that I get to see, get asked about almost every single week, get a phone call related to some aspect of the nutritional problems that we see in young growing carnivores. And I'm going to, there are many potential ones, but I'm going to really highlight just the real most important ones. So just in terms of Felids, quite interesting. Specifically, they obviously obligatory carnivores, and interestingly, the ratios of their preferred diet. So they've sort of tested this in different species of wild Felids, as well as free roaming feral cats and so on. And what they really seem to prefer, they're targeting more than dogs do, is protein. So about 52% of the diet that they would go for is protein. And this is in terms of energy, on an energy basis. So it actually, protein having about half the amount of energy that fat has got in. You can see that they really are specifically targeting protein. So the 52% protein, 46% fat, and then only 2% carbohydrate, which would be in the form of glycogen. Now, cats would have to have some mechanism of digesting and metabolizing carbohydrate. Otherwise, they would develop diarrhea from the glycogen. They wouldn't be able to process glycogen and turn it into glucose. So they do need a small amount. They have to have some capacity for digesting carbohydrate. But just interestingly, I think the best Hills diet that you can get is the Hills metabolic diet, which is 17% carbohydrate, right? That's considered really low carbohydrate. As I said, it's quite different to what you would get in a free-ranging situation if they were eating whole carcass of mice or whatever, where only 2% would be carbohydrate. They are able to digest carbohydrates, as I've mentioned, but they have a limited capacity for that. Depending on the size of the animal, they will either eat the whole carcass. So obviously in a lion, because they are a social species, hunting is a pride, they will not necessarily eat the whole carcass. They will only eat part of the carcass at a time. Most of them have a very limited regulation of protein catabolism. So important difference between humans and cats is cats will have very high functioning gluconeogenesis. That's running pretty much all the time. They're converting a lot of the amino acids into glucose. Their brain still functions very well on glucose. They won't necessarily produce ketones like we do, or not as easily. They have to become full-blown diabetics before they actually produce ketones, where we as humans produce ketones pretty easily when we go through a period of starvation, or if we cut the carbohydrate intake very low. So they have a very high nitrogen demand, and you'll see that they will lose muscle mass fairly quickly if they are starved for any longer period of time. They have a large amount of essential amino acids, again, amino acids that must be present in the diet. They're interesting. Most of the Felids, we think, domestic cats certainly, but we don't think most of the others will be exactly the same. I mentioned previously one amino acid, arginine, that is normally very abundant in meat. Now, they've done some experiments back in the 1970s where they created these artificial diets where they removed arginine from the actual diet for kittens, and you feed them one meal which is completely devoid of arginine, and it actually causes the animals to die. Now, it's the only animal that we know of where if you remove a single amino acid from a single meal, that you can actually cause mortality in these animals. And the reason why is because they develop basically an ammonia toxicity, because the urea cycle is dependent on arginine being available to basically drive the urea cycle. And so they convert, obviously protein gets converted into ammonia, which then in the urea cycle gets converted into urea, which then gets excreted. So as soon as that urea cycle is not functioning, they'll get high levels of ammonia, and that can lead to neurological disorders, and they actually die. They start seizuring and so on. Okay, fortunately, as I said, that's a completely artificial situation. It would never occur in the wild because arginine is abundant in meat, so that's fortunately not a problem. But it just shows you how these amino acids are pretty much essential to them. In terms of their fat, so they also obtain about 45% of the energy from fat. There's also an important source of arachidonic acid and linoleic acid for them. And then in terms of the dietary requirements, they're quite unique in that they cannot convert beta carotenes or any of the carotenoids into vitamin A, so they need a vitamin A as in its final form as retinol in the diet. The same goes for vitamin D3, cholecalciferol. Normally, as humans, we can spend some time in the sun. We would convert 7-dihydrocholesterol, a form of cholesterol, into the cholecalciferol, vitamin D3. Now, in a cat, you can shave all the hair off a cat and you can put it in the sun all day long. It will not make one bit of vitamin D3. All right, and the same probably for dogs to some extent as well. So they absolutely need the vitamin D3 in its final form in the actual diet itself. And they would get that primarily from different organ tissues and the fat. We're going to talk a little bit about that later on. Other things that they do need, they have a limited ability to produce taurine. Although, the Americans really love to harp on about taurine deficiency in cats. It's not something that we, certainly in South Africa, experience, and I'm going to talk a little bit about that. Niacin, one of the B vitamins, they also need it in its final form, and then arginine we've already discussed, which is not of any clinical significance. So whenever I talk to you about these deficiencies, we talk about the big four deficiencies, and they almost always occur concurrently. In other words, we have one may be featured a bit more than the other, but they almost all happen simultaneously because they have the same underlying cause. Perhaps not copper deficiency unless the animals are on a chicken-based diet, but the other three definitely, metabolic bone disease, vitamin A deficiency, and thiamine deficiency all often occur simultaneously in these young cats. All right, so I'm just going to talk a little bit about the formulations because I get asked a lot about that. Okay, just maybe we'll just go back to the issue of hand rearing. So there's a lot of, it depends who you speak to, a lot of people are quite, it's quite controversial as to whether removing, like cheetah cubs, we would normally take them away from the mother at about 10 days of age and hand rear them. And that in itself is quite controversial because they would want them to be parent reared or raised by the mother. But the big issue around that is, and again we did one study with calcium, we only had one cheetah that was pregnant, and we looked at the fecal glucocorticoids in this animal through their pregnancy all the way until those cubs were taken away from her at 10 days. Just to see, because the argument is simply that it's very stressful for the mother when you remove the cubs, and et cetera, and then there's an ethical issue around that. Well, we found that the peak glucocorticoids were actually in mid or late pregnancy. Now this is fair enough, it's only one animal, we'd have to really study quite a lot more to tell. But actually after that they declined all the way through and didn't make a blip on day 10 when the cubs were actually removed from the animal. In natural settings, cub mortality is very high in certain environments, specifically in the areas where there are a lot of lions and hyenas, even leopards. So in the Serengeti, Masai Mara situation in cheetahs, the mortality rate is about 75%, and then it's staggered. You're going to lose one cub here, another cub here, another cub there, and so on. So that mother's going to go through that entire sort of process. But now you look at this individual stress, on day 10, removing these cubs potentially for the mother, which I'm already saying probably doesn't even really exist to a great degree. Okay, she's probably quite relieved to have them taken away at that stage, the way that they normally sort of bother her. But you compare that to the lifetime stress of that cub now taken away, and that is now habituated to human contact, and now undergoes this period of time where it actually is in, if you want to do a medical procedure or a clinical examination on the animal, you want to move it from one enclosure to another enclosure. You just want, to reduce the amount of its stress in terms of its association with humans. All right, the lifetime stress of that animal is reduced dramatically by hand rearing it. Okay, So my argument is simply, if you compare lifetime stress of an animal that has to be darted every time it has to be moved, darted every time it has to be examined, darted every time you want to just get a blood sample from it, where hand-reared animals, you can be easily trained to provide the blood samples without any stress. And I think, when we were doing the study at Kango Wildlife Ranch, Tamlin hand injected all 10 cats for me. Basically because they were used to her going with the animal, get them ready there. None of them were darted. They were just all hand injected prior to, for a research project. And no stress. The animal was still purring afterwards, and then went to sleep. So they went to sleep a lot easier. So all of that, if you add that together, it really does depend though on what your purpose is with the animal. So for me, if that animal is going to stay in captivity for the rest of its life, and there's no chance of it's ever going to be released out into the wild, it's not part of any sort of rewilding program or anything, then if it's rewilding, then I can completely understand. Rather let it be parent reared. You want to have that separation between it and any human. You don't want to have the close contact. But if it's going to be in captivity for the rest of its life, then you want to make it as comfortable and easy, both to manage the animal and reduce the stress on the animal, in terms of its exposure to humans and so on. So then I would argue absolutely that hand rearing is the way to go, except that when you're hand rearing, you need to be very, very careful with regards to the nutrition of the animal. Because remember that they would suckle on the mother probably for anything up to 6 months, sometimes even longer. And during that time, one of the key nutrients that they're going to be getting from the milk is calcium. All right, and calcium from milk, it's already, it's not like a bone that needs to be suddenly digested. You give a 6-week-old cub a bone, because that is the only form of calcium that you can, if you are on a completely natural diet without any form of supplementation, it's not going to digest that bone as it would be able to digest the calcium in milk and absorb the calcium in milk. It'll only probably start digesting bones at about 10 weeks of age, and you're going to gradually introduce it. And that transition period is they don't even have the teeth to, be able to chew bones at that stage. So they've got temporary canines, temporary premolars and so on at that stage still, and they're not able to crunch very, very hard bones. They'll be chewing very small bones at that stage. So that transition period, you're going to need some form of calcium supplementation until they start pushing out their permanent teeth and are able to handle larger bones. So these are just some of the guidelines. I mean, there are a whole range of different products available. A lot of the worldwide, many of people are still using Esbilac as the kind of main supplement for many of the big felid species. We now have a lion milk replacer available in South Africa that's made by Chiron Laboratories. It was problematic a little while ago in that they had a problem with the copper content of it, and we were getting copper deficiency. But I've fixed that for them, so that hopefully will be a lot better. But Royal Canin is absolutely fine to use as well. It's just very expensive to use in lion cubs, and because it becomes, that's probably the reason why many of them weaned so early, is just because the cost of these milk replacers in such large animals become exorbitant after a period of time. Okay, and just provide some of the calculation. I will make these slides available to all of you, so if you don't worry. But this is kind of roughly on 15 to 20% of body weight per day. It just depends on the milk replacer in terms of its kilocalories. The concentration in the milk replacer. But you can use these calculations to determine just how much you should be giving at time. So anyway, it works out at 110 ml. This is for the Esbilac, 110 ml of formula per day. It's more or less about 20% of the body weight anyway. Okay, as I said to you, the very high risk of nutritional deficiencies, and we see those nutritional problems within a 2-week period of weaning. So what often happens in South Africa, somebody will hand rear a cub and then they sell it as soon as it gets to 8 weeks of age. A cheetah cub, lion cub, tiger cub, whatever, it doesn't matter. And within 2 weeks, it'll go to a new owner. The owner knows nothing about nutrition, gives them a mincemeat diet, and within 2 weeks, we've got major metabolic bone disease and major problems. Right, because it's come off the milk and it's now straight onto a solid food diet. Right, it's a major problem. Okay, so we can basically wean them onto a solid food at 6 weeks of age, but then you have to introduce some sort of calcium supplement, where you just produce a calcium carbonate with a calcium diphosphate supplement, which is in the right calcium to phosphate ratio, when fed with some sort of meat-based diet. Once they're 3 to 4 months of age, they can handle smaller bones, and then you can basically build those up over time. Just wanted to show you this. I mean, again, it's very small. You won't be able to see all the details over here other than the colors right at the... Yeah, this was just a comparison I did quite a long time ago where we looked at the nutritional content in the first column of 1.5 kilograms of beef, which is roughly what a cheetah would eat per day. A whole bunch of different nutrients there, starting off with calcium, phosphorus, vitamin A, D, E, all the B vitamins, biotin, folic acid, pantothenic acid, niacin, taurine, copper, magnesium, selenium, iron, zinc, iodine, sodium, and arginine. And then we added the nutritional information from, at that time, a commonly used supplement, the Predator powder that is available in South Africa. Calculated the total, then I estimated the requirements, and that's again based on cat nutrient diets, because we don't really have specific nutritional information for the cheetah, but we expect them to be very, very similar. And then calculated the excess or deficiencies. Now, bear in mind that that is now a meat with already, to which a supplement is already added, okay? And then you calculated either the percentage of excess in black or the percentage of deficiency in red. And what you can see here is that we still end up with some quite serious deficiencies. So, for example, vitamin B1, a 73% deficiency. Even the calcium, we're in 19% deficiency. Now, there's some things that I don't know. Iodine, I'm not sure that there's absolutely no iodine at all in that, but that worked out to be 100%. But copper deficiency, so even folic acid, 71% deficiency. So clearly, there's still quite a lot that needs to be filled in terms of the gaps with regards to what needs to be in the diet. Okay, so the first of the big four is metabolic bone disease. Obviously, free-ranging felids eat a whole prey. They consume all the not only the skeletal muscle, but skeletal muscle itself has a very low calcium content. Normally, most species, doesn't matter what they are, during the growing phase will need at least 1% of their diet needs to be calcium in some form. On a dry matter basis. Now, muscle meat, the calcium content is sitting at 0.03% calcium. So you've at least got a 20 times too low a calcium concentration. And then obviously the calcium to phosphate ratio, which normally needs to be about 1.5, sometimes up to 2 to 1, depending on the species. Is greatly inverted in that you have 1 part calcium to 20 parts phosphate, a lot more phosphate than you have calcium. Generally, muscle meat is pretty low in vitamin D3. Okay, and as I said before, they absolutely need it in the diet because they're unable to synthesize it from that 7-dihydrocholesterol. This is the typical kind of thing that gets fed to these youngsters, is just minced muscle meat with very little else. Or you might have these large chunks of meat, from either horse meat or from cattle, and the animals are unable to chew the bones or get any part of the calcium from the bone because the bones are too large. This is just a table to show you some of the common things that are fed to cats, both large and small. And then right at the top there, I've just put feline hills maintenance, the dry, showing you that they do have the 1%, just over 1% calcium. With the right calcium to phosphate ratio, roughly 1.3 to 1. But everything else, lean beef or bovine heart, tuna being some of the worst, very low calcium concentration and a terrible calcium to phosphate ratio. If you look at mature chicken, this is now broiler chicken, for example, it shows you just why it's bred obviously for its muscle mass. So you have a disproportionate amount of muscle relative to the rest of the carcass. So even there, you're not reaching that 1%, you're at 0.65 calcium, but at least you've got a better sort of calcium to phosphate ratio. Many zoos also use day-old chicks for the smaller cat species, and this is just to emphasize too that they don't have calcified bones yet. So although they might provide quite a lot better than the lean beef, you're still sitting with a very low calcium concentration of 0.44. Okay, so you need to then also consider adding a calcium supplement to that. So I was just going to say, in terms of which is more important, vitamin D3 or calcium, in my view, calcium is way more important. I mean, obviously you can't do, you need the vitamin D3, but you've still got a certain amount of vitamin D3 in muscle meat, especially if they're getting a bit of extra fat, because it is stored in larger amounts in fat. And yes, if you feed the organ tissues, the liver and particularly the kidneys, you're going to get quite a lot more. But in my experience, most of the animals are not suffering so much with a vitamin D3 deficiency as they are calcium deficiency. Calcium is by far the most important of those two, but obviously you need both. The clinical feature of this stands out is pain. Okay, all of the other deficiencies appear to be relatively painless. They cause quite severe neurological dysfunction, but it's not necessarily a painful experience for those animals if they are dominant. As I said, most of these occur concurrently, so it actually sometimes becomes an academic exercise trying to tease apart which is more important, the vitamin A deficiency or the metabolic bone disease or copper deficiency or whatever. But pain is the classic experience. This often in the hindquarters, they are severely lame, reluctant to move. Then if that progresses, you get multiple fractures. In tigers particularly, it seems to be the femurs that go first. In cheetahs, we get severe angular limb deformities, bowing of the long bones because of the growth plates. That's where you get the most growth. It's also quite painful. Those growth plates really quite painful on the distal radius and ulnar. And sometimes even in cheetahs, you see the complete obliteration of the femoral heads. So there's a radiograph just up there of a cheetah that has got no ball on the femur. It's just gone. So that's an animal that's about a year of age, and it now basically has no functional hip joints. This is from Fowler. This is just a spinal fracture, which also can cause quite severe neurological deficits. Very importantly, in these animals, you can measure the blood calcium levels, and they're absolutely normal. So the reason is that the blood calcium does not reflect total body calcium at all. So the body will sacrifice the bones in order to maintain blood calcium level at a very stable level, because once your calcium in the blood starts dipping, then you're going to start ending up with hypocalcemic tetany. We see that in a lot of primates when they develop this kind of condition, but you don't see it in carnivores. I mean, if their blood calcium levels are low, then you're in at the end stage of this kind of problem, and it can be quite severe. So sometimes you can measure the actual vitamin D. The most human labs will do a 25 hydroxy vitamin D for you, and if the levels are lower than 20 nanograms per milliliter, then you're probably ending up with a bit of deficiency. You can also measure parathyroid hormone. Some labs will also do parathyroid hormone for you. But basically, we don't send blood samples away to the lab and then wait for the results. We normally would start treatment immediately based on the clinical history and the history, the dietary history, and the clinical signs that we are seeing. This is I think about a 4-month-old white line cub, and you can just look at the way in which it's moving. Okay, that animal with quite a lot of pain. And this is common, very common. We see this all the time. Okay, people acquiring animals, and in South Africa it's a whole different story. It's a bit of the Wild West in terms of what you can own and what you can get, depending on which province you're in and how much control there is over that. So many farms will, especially certain provinces will be able to get permits to be able to get lions or whatever, or will have historical permits to be able to do that, and but they don't necessarily have any idea of how to feed these animals. So unfortunately, now there is a bit more control coming in, but it still happens very often that people will pay a fortune, often pay for an animal like this, and that's what always amazes me, is that they'll spend 100,000 rand, for example, on an animal, and then they don't bother contacting anyone to find out exactly what it should be fed or how, because it's thought where it's obvious it eats meat. So again, we end up with a major problem. Fortunately, if you treat these correctly, you can get them back to normal within a short space of time. This is exactly the same sort of scenario. This is a cheetah, 4 months old, was weaned off its mother milk. 2 weeks later, it sits with this kind of situation. where it had generalized fungal infection on its skin, so dermatophytosis, and these angular limb deformities. The animal couldn't stand or walk. And there's just the radiographs of the front legs. Again, get this typical, in cheetahs, get this angular limb deformity because of the growth plates that are affected and very, very painful. And then I think this is, yeah, that same case, just a different view. The other thing that you get here is the collapse of the pelvis. So you've got those two sides of the pelvis. The one side often collapses in. And that's quite a serious problem because that animal is going to end up with a chronic, well, if it's a female, you've got a major problem with it giving birth. It's not going to be able to push cubs through that pelvic canal. Male or female, it could end up with a severe problem with constipation. So the bone doesn't actually break, it just folds in, and then it's, unless you do surgically go and correct that, the animal's going to need to be on some form of laxative, or you're going to have to monitor its fecal production to make sure that it doesn't become constipated because of the narrowing of the pelvic canal and the feces can't move through the canal properly. So this is just an interesting one. 6 cheetah cubs. This is a wild actual cheetah. And that makes it quite unique, but you can see lameness on 2 limbs, 1 front limb, 1 hind limb. Interesting thing here was, so this is a wild cheetah. The mother was hunting springbuck, but she's got 6 cubs, okay, which is quite, cheetahs are unusual in that they can produce a large litter, and we think that that's one of the main reasons for that is that they often lose so many cubs to other predators. But in South Africa, we're regularly seeing them raise all 6 cubs to maturity, which is quite remarkable. And obviously, that's resulted in a massive expansion of our specific populations in South Africa, which I'm going to talk a little bit more about tomorrow. But the issue here is the limiting factor in terms of nutrition, again, comes down to calcium, because these cubs are about 4 or 5 months old. They will follow the mother, and they will start eating on her kills. But because their teeth are still temporary canines, they will not be able to eat the bones from that. They'll eat just the soft tissue, the muscle of the springbuck or whatever she kills. They're obviously still suckling on her, but you can imagine 6 of them competing for suckling space. And if her milk production isn't at a maximum for that number of cheetahs, then 1 or 2 of those cheetahs are probably going to drop out and not be able to get enough milk in. And so their calcium intake is going to be limited. And that's what I think happened in this sort of situation. The one that was lowest in the pecking order was the one that ended up getting quite severe metabolic bone disease in a wild situation, which is not something that you would normally expect. So this little one, exactly the same one. Again, you get these really swollen distal limbs. You can even see that slight zigzag over the wrist or the carpal area. And that's mainly due to the growth plate in that very fast-growing bone. This was on the hind limb. Again, right at the bottom there, it's not a great radiograph. It's just a photograph taken from a screen. But again, there's a lot of instability around the bottom of just above the ankle. And then very importantly, you can see what happens with these temporary teeth. So they're all fractured. You can see that the canine over there it's the baby tooth, the deciduous tooth, and it's already fractured. The tooth canal, root canal is open, so you get infection in the root canal, and you can see the massive gum inflammation that you get because the bacteria are going into these teeth, and those teeth all need to come out. So that's exactly what was done. All the teeth the temporary teeth were removed. The permanent teeth obviously still erupting below that, so they would come out. But this animal could hardly eat because of the pain in the mouth from the damage to the temporary teeth, having forced to try and eat bones and things like that without having much calcium available to support the strength of those teeth. Right, so calcium, really, we've talked about that 1% of dry matter intake, and just a little bit of calculation over here. So if we take 1 kilogram of meat, we in South Africa make biltong, so you take 1 kilogram of meat and you dry it, and it turns out about 300, jerky, it's about 300 grams after you removed all the water. And then that means that basically, you need roughly 3 grams of calcium in that piece of meat in order to be able to meet their metabolic demands. We often use some studies in Great Dane, because the Great Dane dog, will grow pretty much at the same rate as some of these other animals and reach a very large size. So what you have to understand is that a lion, for example, goes up to 180 kilograms in 3 years from about 1 kilogram when it's born. Now, if you imagine what a human gets up to 90 kilos, if you're about my size, in about 20 years. So the actual growth rate difference between these large carnivores and the human is completely different, okay? They are growing incredibly fast. And that growth, they need to support by providing sufficient calcium for the skeletal growth. So we calculate here roughly, just give you some idea, 3.5 milligrams of calcium per kilocalorie per day. It equates to about 10 to 15 grams of calcium per day. That's elemental calcium. And if you were to give a lion cow's milk to meet it, which don't ever do that, but if you have to give it cow's milk to meet its calcium demands, it would have to drink 12 liters of cow's milk per day at peak growth, just to give you an idea. So that's a massive amount, 350 to 500 grams, half a kilo of bones, okay, and that's like bone with cartilage and the marrow in, and so raw bones, you know, that they would have to consume per day at peak growth, which in lions would be roughly at about 12 to 14 months of age where they reach their maximum growth. And then they must be in the correct ratio of phosphorus, calcium. Fortunately, there's a lot of phosphorus in meat, muscle meat, but still not adequate. So you've got to add a little bit of phosphorus to the actual supplement if you're going to do it. So that's why we use a calcium diphosphate supplement, and then we combine that with a calcium carbonate as well. So mix those two together in a specific ratio, and then when you can really use that if you need to. So just cheetahs doing the same sort of calculations, they're going to need about 100 to 150 grams of bones per day at peak growth. Okay, if you're not providing any other form of calcium. And bones are ideal form of calcium because they're in the correct ratio. They got it in the correct form. It's easily absorbed if those bones are properly digested. So then you never really have to worry about overdoing it in terms of calcium if you feed it in the form of a bone. Right? But bones also have downside in that they must be digested properly, otherwise you end up with a bone stuck in the intestine and causing a medical emergency. Right? So digestion has to be fairly optimal for them to do that. So an animal that comes in, you know, if it's got metabolic bone disease, it's been on the wrong diet, very low collagen intake, you know its digestion is not going to be good. So you really don't want to suddenly start chucking bones at it. And hoping that it's going to suddenly start digesting them. You've got to start it on another calcium supplement in the meantime, a powdered supplement ideally, and then gradually introduce it onto bones again to be able to digest the bones properly. In terms of vitamin D3, roughly estimate, I mean, you don't want to overdo, it's one of those that I don't like overdosing so I don't chuck a whole bunch of vitamin D at them. 250 international units per kilogram of meat is roughly what you want to have. The highest concentrations are in the organ meat and in the abdominal fat. So kidney fairly high, liver fairly high, then blood, and then perhaps skin, and then muscle being the lowest of all of them. So if you look at beef kidney, it's probably the highest, 1,000 international units per kilogram, and then other things like beef liver and beef itself. Beef would be too low, you know, because you're not nearly getting to that 250 international units per kilogram of meat. Just to be aware that fish oils, many of those fish oil supplements contain quite a lot of vitamin D, and you've got to be very careful to not overdose it by giving them too much of the fish oil supplement if you are using that. All right, so that's metabolic bone disease. I'd say it's just a big problem. And probably around the world. I mean, the Middle East, where they also have a large number of carnivores, we also have a major problem there. The second one that we see the most commonly in lions and then in cheetahs is vitamin A deficiency. We've mentioned that it's only present in animal products. You don't get vitamin A in any plants. You only get the beta carotenes. And they can't convert that. Actually, I mean, when I worked in the UK, I had one of the worst cases I've ever seen of a cat. I mean, a lady that decided that she was going to make a vegetarian out of her cats. And so she fed them a vegetarian diet. And they came in, they were smelly, grease-covered coat, had chronic mycoplasma infections in the respiratory system. And I've never seen cats that look sicker in my life. Admitted them into the hospital, and then gave them Hill's AD or something like that, and they made a a recovery over a 2-week period, and then we eventually, I mean, after this happened more than once, I had to call in the SPCA because I think really had to have the cats taken. There was a real problem. But they don't do well if you try and they absolutely must have animal tissues. All right, so they can absorb the carotenes, but they fail to convert them, and probably true we don't, in wild felids as well. So the highest concentrations of vitamin A are in the liver. The liver really is the superfood, and the important thing, I say that there's 2 things that wild animals will probably need. The critical 2 organs is bones and liver. They can probably do completely without any muscle meat at all. Because the bones, they will still get the collagen from that and the calcium. And then the liver, they get pretty much all of the other vitamins, the copper, the vitamin A, vitamin D, folic acid, all the B vitamins, present. So liver is a key food for many of these species, and they need to have liver somewhere in the diet. Okay, if they don't, then you've got to provide them with a substantial other form of supplement. All right, so lions and cheetahs primarily the ones that are affected most. So the clinical symptoms here, just to show you this cheetah, you see how it wants to sit down. Okay, they develop this real weakness in the hind quarters and reluctance to stand. But notice that they're completely aware of their surroundings, which is important when we'll get to the next deficiency. But yeah, this wobbliness in the hindquarters, swaying from side to side. It appears almost as if the hindquarters are separate from the front animal. If you've seen dogs like that have wobbler syndrome, where they've got a lesion in the neck due to malformation of the neck vertebra, they look very similar to this. Now, the only thing I would say is that copper deficiency is almost identical, and it's almost impossible to differentiate between vitamin A and copper deficiency. They look almost exactly the same. Again, I'm stressing just that this you're not likely to see in an adult cheetah. Okay, even if it's got a copper or a vitamin A deficiency, it's not likely to develop this. This is because of the development of the nervous system and the bone growth that you actually see this in animals usually that are younger than 2 years of age. But it can develop. You can get tremors, you can get seizures, you can get head tilt, stargazing, sudden onset blindness, also possibilities. Here's just another cheetah, just again showing you just that reluctance to stand. They often flop down on the back legs first, and are very reluctant to want to get up and walk around. I don't think this one actually got up again. So the lesion in lions, it's very interesting, is slightly different to that in the cheetahs. So the reason why vitamin A deficiency causes a problem in lions is because the vitamin A is very important in the function of the osteoclasts. Osteoclasts are little cells that break down bone. Osteoblasts build it up. But basically, the flat bones of the skull in lions are dependent on these osteoclasts to remodel and reshape the bone as the skull develops. Now, when they don't do that, you get this thickening of the skull bones. And this thickening of the skull bones actually causes compression or overcrowding of the brain. So you get this the brain becomes quite compressed. And in some cases, it can be so compressed that you actually get the cerebellum, which is that part of the back of the brain, herniating through the foramen magnum, which is the hole at the back of the skull where the spinal cord comes out. You can the part of the brain can actually herniate or slip out of that hole in severe cases. And obviously that's going to cause severe mental or neurological dysfunction. In cheetahs, most of the lesions are in the spinal cord. You get some thickening of the skull bones as well. So if you take a radiograph like this, lateral radiograph, you can measure the skull bone. And normally we'd say in cheetahs that bone mustn't be more than 4 millimeters in thickness. If it's more than 4 millimeters, we've probably got a vitamin A deficiency. But the main lesion is in the spinal cord where they get the syringomyelia, which dilation of the central canal and abnormalities in the spinal cord. And that's what then causes this wobbliness in the hindquarters, or weakness in the hindquarters. All right. So in terms of vitamin A, the normal intake should be somewhere around 3,500 to 7,500 international units per kilogram of meat. Again, I mean, the Americans to some extent, no disrespect, but they're often worried about vitamin A excess, so overdoing it on the vitamin A. I'm yet to see a single case where an animal has been overdosed with vitamin A, a carnivore, I mean. If you're human and you're pregnant, then you've got to be really, really careful of vitamin A overdose. But these carnivores, because they are able to excrete excess vitamin A in the form of a retinol ester, it's highly unlikely that they will ever get this. I mean, some of these polar bears, for example, they're sort of apex predators where they are eating seals, eating the liver of a seal, which is already very, very high in vitamin A, are getting massive, massive concentrations of vitamin A. And they don't develop any problems at all. Now, for our other predators where they are not feeding on predators, it's unlikely to be as high, but still they seem to be very resistant. So they've only managed to experimentally induce vitamin A toxicity in cats, and that causes bone abnormalities as well, increased risks of bone fractures, but we've never seen that in some of these larger felids, so it's really not such a big issue. The highest concentrations, again, in the liver, and then in the kidneys, and then very low concentrations in muscle. And then beef liver, again, especially if they've been grass-fed, they have very high, anything that's basically got, eating grass is probably going to have a very high content of vitamin A in the liver, as well as copper. And so beef liver, and then pig's liver, and then maybe chicken's lower. But all of them do contain sufficient amounts of vitamin A, and absolutely fine to give. I think there's a lot of concern about feeding liver and the potential of salmonella and E. coli infections, and liver is often very difficult to maintain in a fresh state or to keep defrozen. My argument again really around that is if you've got proper digestion and proper gastric acid production, then that is almost never a case. I've never seen an actual cheetah, adult cheetah, ever die from E. coli or salmonella as an infection, never. Not a single case. So they're pretty resistant to it, even if they've got gastritis and low acid production. So it's really not a major issue. It is a potential issue in young cubs, where the immune system is still developing, but not in an adult animal. So I think the advantages of feeding liver to them once or twice a week in order to maintain their vitamin A status, I think, is absolutely justified. Thiamine or vitamin B1 deficiency, it's the third of the big four. So young cheetahs are again exactly the same thing, fed on skeletal muscle, which is very, very low in vitamin B1. It's also one of those things where if you increase your fat intake, your requirement for vitamin B1 increases as well. So you've got to be careful of that. Also, if you have a lot of alcohol, you also need to have more B1, but not so much a problem in cheetahs. Okay. And then if you've got gastrointestinal disease, the bacteria, they will break it down. So a really important thing, though, is the bacteria that are found in the gut of animals, prey animals, and particularly in fish. Okay, we're not feeding fish here, but if you have any sea mammals, that's the reason that we feed them routinely vitamin B1 in their diet. I mean, most facilities around the world, supplement their sea mammals, their seals, with vitamin B1. Because the fish, even if you feed human-grade, fish to these animals, the risk of thiaminase bacteria actually produce an enzyme, thiaminase, which breaks down the vitamin B1. So if there's any contamination of the meat with with this bacteria, then they're going to break down the B1, even if you've got it in the diet, and that is going to then lead to a B1 deficiency. In slaughtered carcasses, again, if there's any contamination, rumen content or intestinal content that contaminates the meat, you increase the risks of these thiaminase bacteria breaking down the vitamin B1, and then it not being available to the animals. So those are the major causes of vitamin B1 deficiency. In my experience, caracals and serval are very, very susceptible to vitamin B1 deficiency. I'm not exactly sure why, but we certainly see some very, very severe cases. The major clinical symptom of this particular one is the fact that you get changes in the mental awareness. So these animals, you saw the cheetah with a vitamin A and copper deficiency, they're still completely aware of their surroundings. It's only the hind quarters that don't really work. And these are not in pain like you get with the metabolic bone disease, but they can be completely out of it, as if they're not aware of their surroundings. And I'll show you a video in a moment. They can have acute blindness as well due to an optic neuropathy. In the case of vitamin A deficiency, the blindness is often caused by increase or narrowing of the optic canal, where the optic nerve runs through the skull. Because the skull bones are thickening, they get narrowing of those canals, squeezing the optic nerve, and then you can get acute blindness. In this case here, you get an optic neuropathy because of the B1 deficiency. Seizures, tonic-clonic front lobe movements, and then elevations in lactate, and if you can measure it, erythrocyte transketolase activity can be increased, although, I mean, you hardly ever do that. You, again, you can't wait for lab results with regards to these animals. They need to be treated immediately based on the clinical symptoms and history. Now, the reason they get these problems is because they develop bilateral necrosis in the actual brain itself, and depends on how long that necrosis, is been there as to whether it becomes permanent. Sometimes the necrosis, as it heals, can result in a center in which these animals can develop epilepsy, and that can then continue lifelong. So the earlier you treat these cases with massive doses of injectable vitamin B1, ideally, the better they respond. And the key difference between this and vitamin A deficiency is that the animals do respond. Within 2 days after treating them with vitamin B1 infection, they will be virtually back to normal again. Whereas with a vitamin A deficiency, it's going to take 2 to 3 weeks sometimes before they're back to walking normally. Again, it all depends on how early you start treating them. You notice the symptoms and start the treatment. This is a serval, and you can see all the limbs affected, front and hind limbs, and you can see that the animal's head position, mentation, and everything else is really affected by this. And this animal, again, after being treated 2 days later, was absolutely fine again. Now, it's a very sad picture to see them like that. Now, so you just got a variety of different B1 treatments available. Fortunately, most large animal, livestock vets will have B1 available because they use it in livestock as well. Basic prevention is the storage of meat. It needs to be properly slaughtered, no contact with intestinal content, and then, if in doubt, supplement with at least 5 milligrams per kilogram of meat of vitamin B1. If you're feeding really fresh meat and you're adding liver and so on, then it's hardly likely to be a problem. Okay, number 4 is copper deficiency. And copper, to list all of the things that's involved in is really endless. It's really important in collagen function and structure in collagen. Copper deficiency in humans has been known to cause acute aortic rupture. So you just develop an aneurysm in the aorta and it ruptures and then you bleed to death. Okay, it's quite a severe. We don't see that in many other species. It also, I've seen kudu bull with dislocated shoulders from a copper deficiency because, again, the collagen structure and strength is so it seems to be very species specific as to what you see. In lions, I don't know if you've seen these large hygromas on lions, so in lion cubs, they develop these very large swellings over the elbows. And I think that is related to a copper deficiency primarily because there's a lot of connective tissue around the elbow. And the weakness in that connective tissue leads to these swellings, which then eventually resolve. They do go away on their own. But I think it's probably related to copper deficiency. And then, it maintains immune function, testosterone levels, neuronal signaling, and that's probably in the cheetah where the most common thing is. It's important in the development of the myelin sheath, which surrounds the nerves, and important in nerve conduction, wound healing, and generation. So copper is involved in almost all these functions in the body, so it's really, really important. So the main thing that we see copper deficiency is when they're on a diet of chicken. Chicken meat itself is very low in copper. So the sort of ideal intake is around 5 to 9 milligrams, depending on the growth phase of these animals, per kilogram of meat. Chicken only contains about 1 milligram per kilogram. Okay. The highest concentration is in the liver, but in chicken liver, you're only just getting to that 5 milligram per kilogram. So even that is just meeting the requirements if you had to feed liver on its own without any other part of the chicken. much higher in any poultry that will eat grass. So turkeys, geese, ducks do a lot more grass grazing, and so their levels of copper will go up quite substantially. If you look at pig liver, it's only getting up to 7 milligrams per kilogram, and then if you go to beef liver, it suddenly shoots up to 100 milligrams per kilogram. So you could probably overdose a bit on copper if you had to give just beef liver too frequently. But even once or twice per week, I mean, to most of our carnivores, beef liver would still be fine. So they have just given you some calculations. 50 to 90 grams per kilogram of total meat fed per day would meet their needs, and that would be both for vitamin A and for copper. If you're really sitting with a specific copper deficiency, you could use copper sulfate that's just injected into the meat. But you then go up as high as 20 milligrams per kilogram, basically because the sulfate part of copper sulfate, you need that 5 milligrams of elemental copper, and so because copper sulfate's copper and sulfate, you've got to go higher with the total milligram dose. All right, I think how many have got? I've only got 2 slides left. Okay, so I'm just going to talk a little bit about taurine deficiency, because as I said, it's often, I mean, you can hardly open a textbook on carnivore nutrition and taurine will pop up immediately somewhere along the line where people will want to talk about it. To be honest, I've never seen a case of taurine deficiency in a large carnivore. Now, it may be because we in South Africa only really feed raw meat. It's hardly ever processed. Cooking it would be just a waste of time. And that is essentially, in North America, many of the zoos provide processed forms of meat, and in the early days when they were developing processed meats for cats and domestic cats and dogs, they encountered quite a lot of issues with taurine deficiency. And taurine, when you cook the meat, it basically is leached out into the actual water that remains in the pot after cooking the meat. Whereas if you just feed it as is to the animals, they have very high taurine content. Any muscle in a prey species that works very hard, so cattle, masseter muscles in particular, because of the fact that they chew their cud, they're recycling and they're chewing a lot. Muscle is going to contain a lot of taurine. Heart muscle, which is a hard-working muscle, is going to contain a lot of taurine. Horses, the legs are going to, any of the muscle meat in legs on horses are going to have a lot of taurine. And as I said, to be honest, I've never seen taurine deficiency. The classic signs of taurine deficiency would be damage to the heart, so you get dilative cardiomyopathy, you get damage to the retina, you get retinal degeneration. We just don't see that. We get some fibrosis in the heart muscle in cheetahs, but the cause of that, I think, is completely different. And that's often associated with renal disease at the same time. All right, so it's not really a major issue. I would say that the only thing is that it's potentially broken down by intestinal bacteria, and I'm seeing some evidence of lower taurine levels in cheetahs that have got higher levels of gastritis. But again, even in those animals, I'm not seeing clinical signs of taurine deficiency. So it may be an issue, but because of the breakdown of taurine in the gastrointestinal tract. Okay, not something I'm particularly concerned about. Okay, and then I was just going to show you just here, I mean, this is just again one of my products that I produced compared to one of the other ones that's available in South Africa. It'd be lovely to be able to get that exported, although it's quite difficult to get it here and probably not worth the shipping costs, but many of these you can actually sort out for yourself. But just to show you that some of these products like this, the copper, there's no copper in the actual diet. The vitamin B1 concentration is way too low, in that vitamin A content is also way too low. So people think that they're supplementing with a product that's going to work, and it's just not going to be adequate.